be a great doctor, you have to care about people, not just as patients, but about people. But you also have to have a drive to be not satisfied with what we know and to really think that something better should be done and to be part of the change process.
Someone I know in this community called me up to tell me she was diagnosed with breast cancer. She had to travel such a distance to get the quality of care that she expected and needed. And that led me to the decision that I do need to give back to my community.
Piedmont aspires to be one of the top systems offering extraordinary and comprehensive care across a state. There's no other system that I know anywhere that has that.
At Piedmont, when you embrace technology and you bring new ways of treating things into the healthcare sector, you attract the best talent into the hospital system and allow patients to have more options for achieving a cure.
Those of us who have loved ones who are going down a trail of a difficult cancer, it's sometimes hard to appreciate how far we've come. There are types of cancers and stages of cancer that are now treatable that even 5 years ago that was not possible. None of that would have been possible without research. For certain stages and types of cancer, the best care today is to be part of a cancer clinical trial.
Clinical trials are important for any patient. For patients that have gone through 4 lines of chemotherapy but still have good performance status, it provides hope for them that we can have another chance. So it is important for us to have access to these tools. We have individualized medicine now. We look at each and every tumor and we see what is the best way for us to approach that tumor.
What I think is a unique opportunity for Piedmont is that you can get enrolled in a trial, but you can have the treatment protocols and the implementation done at one of our many hospitals located closer to where patients live. A lot of other centers don't have that resource.
You know, the next big thing in healthcare, we've been focusing for years and years on how do we treat. But what's really important is how do we prevent?
It can come in improving our use of imaging. Great screening programs. We're going to be replacing the majority of our linear accelerators with the latest state-of-the-art equipment.
We also have these Chapman Family Cancer Wellness Centers strategically located throughout the Piedmont system.
The wellness centers focus on bringing that person back to their best life. The logistics of cancer care, the side effects of therapy, the fatigue, the anxiety can only be addressed if the patient is addressed. And that's really what the wellness centers are about. So we are tremendously grateful to the vision of the Chapmans to support these, and we also see that expanding to more and more of our hospitals as well.
We have cancer navigators that contact patients directly, work with them step by step throughout the entire process. That, I think, is the personalized touch that's provided at Piedmont.
Cancer care is changing every day. And for us to be at the forefront of that change, of that innovation, of that growth, we need support.
Philanthropy is what allows us to execute many of the goals that are really critical to our cancer patients and our care. That includes clinical trials. That includes starting programs like a genetics program, a navigation program, a wellness program. Every cancer program in the country, which is successful, has a strong community base of support.
The funding for clinical research is absolutely critical, and we cannot afford to let this challenge and opportunity pass us by.
When we remove a cancer and get definitive proof that we have provided a curative operation, that is the most rewarding conversation that I could possibly have with a patient as a physician. It truly inspires me.
I've been doing this for a long time, and I've seen us progress through all kinds of different types of treatments and improvements. But would I be happy if we could just put the oncologists out of business altogether? Yeah, don't you think that would be awesome? We wouldn't have to treat this disease, we could prevent it.
I think we've already shown what Piedmont can do as a health system The caregivers we hire, they're making a career commitment to Piedmont. And we're growing with high-quality programs that are rapidly expanding across the state. And that really is fulfilling our mission of really reducing the cancer burden for the people we serve. We're making a positive difference.